The United States government and the government of Botswana have been working hand in hand for over 20 years to end Botswana's crushing HIV epidemic. We are now very close to reaching that goal.
Throughout implementation or throughout the partnership between the government of Botswana and the United States, we have seen so many successes. We have seen Botswana move from a highly burdened country with HIV to now being one of the best countries when it comes to the HIV response.
There were times where we were going to the funerals on every day. But nowadays you'll see that the incidence rates have gone down. I think it has been great collaboration and engagement, both technically and financially from the US government.
For the past, more than 20 years, PEPFAR has been supporting the government of Botswana, and it's through this, significant support that Botswana has been able to reach epidemic control.
As a result of this partnership and decades of hard work, Botswana has achieved the UNAIDS targets for HIV epidemic control and has reached the milestone 95, 98, 98.
So this basically means that 95% of the people that need to know their status know their status. And of those that know their HIV status that needs to be in treatment, 98% of those are on treatment. And of those that are on treatment, 98% of those are virally suppressed.
Despite this progress, Botswana's efforts to become an AIDS-free nation are not over. There is still important work remaining to finish the job.
There are still a number of challenges that we are facing despite the significant progress.
Adolescent girls and young women are a very special population or subgroup of the population who are very vulnerable to contracting HIV due to different factors.
We are looking for the adolescent young girls and young women 15 to 24 years that when you look at the bias results, most of them don't know that HIV status.
According to the statistics, we still have gaps amongst the young children. We still have gaps amongst the certain ages of men, the key populations, as well as the adolescent girls and young women. Generally, men have got poor health-seeking behaviors. I mean, they don't get to the healthcare facility unless they are totally ill.
We need to come up with innovative strategies that would make men attracted or attract men to access clinical services. We don't want to regress the gains. We don't want to lose the gains that we have done so far. We don't go back to where we were back in 2000 when HIV first hit the country.
We need to find those people to be able to reach the 100 and 100 and 100, but continue maintaining it, which is a big task.
USAID is excited to announce the launch of new programming in Botswana as a gift from the American people to help finish the race for epidemic control and look forward to total health for the population even beyond HIV.
This new programming is different from how we've been programming because first of all, we have consolidated our programs. This new programming is totally comprehensive.
What I like most about this project is not only focusing on clinical interventions, but also some of the interventions that address some of the socio-demographic issues that are underlying HIV and other social ills.
And the government has taken this decision to ensure that moving forward, the approach towards health in Botswana is holistic.
It's not only about HIV, but you might find that the person have hypertension, have diabetes. So for you to show that you really care for that person, you need to provide the holistic care.
Hypertension is the #1 killer right now. We look at TB mortality or TB deaths among the people that are living with HIV/AIDS is very high. If our mission is to save lives, we can no longer just looking at HIV/AIDS programming as the only way to save lives.
In addition to a holistic approach that considers the total health of the individual, the new USAID programming also supports the government of Botswana's commitment to revitalizing primary health care.
Primary health care revitalization really means going back to our roots, going back to the way we used to do things, going into the community to ensure that we improve access to clinical services. We reach out to families at home and ensure that they are able to access healthcare services from where they are.
We are there to support and be the extension hands of government of Botswana to reach the community, because as civil society organizations, we are the foot soldiers. We are in the communities.
And this is coming in totally at the right time, because for us to sustain the gains that we made with HIV/AIDS, we need to go back to the crossroads and think primary health care.
These are the populations that are in the cattle post somewhere, that are in the land somewhere, that are not able to walk to a nearest government facility. I'm excited about them knowing the options of clinical services that they can access.
USAID is bringing 8 expert local organizations and 1 international NGO together to deploy the new programming, all of which supports the goals of the government of Botswana.
Through many years of working in PEPFAR, 20 years, USAID has supported a lot of partners in the past and built their capacity to be able to support the people living with HIV and other health issues.
We are bringing the expertise in working with children, working with young people, working in treatment, working in care, so which is working in gender-based violence, so which is brings all the elements and really so that we can provide a whole care.
Since 2000, we've worked with USAID, coming up with ideas, different activities to ensure that we really spread the message to try and prevent the spread of HIV.
The local organizations, we have been working with them for the past 14 years, and we have been leveraging on their deep understanding of the context and their connection to the local communities. They have a deep understanding of the communities, the community structures, the leadership, and they are able to engage.
We are excited as a local organization to be receiving direct funding from USAID and also be able to show that we have the capability to also work very closely with other local NGOs in the country to be able to support government in sustaining the gains of HIV.
As we work to cross the finish line of HIV epidemic control in Botswana, USAID's new programming is driven by innovation and committed to doing things differently to reach people who still need assistance.
This is the time to really look at the whole person, the specific needs of the different subpopulation, and be able to tailor and work together with the population that we are serving.
We are targeting the men, we are targeting the adolescent girls and young women, we are targeting the young people, we are targeting the children, as well as the victims of gender-based violence. These are the populations that we still haven't reached, that we need to reach.
We need to be innovative, we need to be creative, we need to stop doing things the usual way. We need to go and find the right people at the right time and give them the right messages.
In celebration of the partnership between Botswana and the United States government, through PEPFAR and USAID, we look forward to the achievements this new programming will bring for the health of the nation.
We have done so much work to get where we are. We are almost there. Right now is when we put everything on the table for us to cross that finish line.
I would like to congratulate the government of Botswana for having pulled through to where we are right now. And I would like to really thank the government of the United States for having duly supported the government of Botswana, so that the two governments, with the determination that they have been able to get the country to where it is.
We really thank the people of America for the funding that we are getting from them, for us to continue to serve our communities, to be able to ensure that we attain the gains that we have made on the past.
On the last mile, I think we need all hands on the deck and be able to, we will recognize there are, you know, different partners, different stakeholders that have specific, you know, and differentiated strength.
I'm really excited to see us reach a point where we are saying we do have an HIV-free generation. I think collectively, if we put our minds to it, 100, 100, 100 is almost there.
We are there to support you, to walk with you, so that you can be healthy and see your future and reach your dreams and aspirations in a healthy way.
For me, looking at where we are coming from and where we are going, I'm saying we are really seeing a bright future.
We are not going to be shining only about the HIV/AIDS, but we'll combat TB, we'll combat the NCDs, we'll talk about the success of Botswana health care system. The future can be brighter than it is if we hold hands.